Right. Assalamu alaikum. So today we will be seeing about the histology of the muscles and the joints. Okay, so in yesterday's topic we were seeing the major muscles in the body. Okay, so today we will be seeing the histology, that is the microanatomy. You already know the function of muscles. The muscle, the main function is when they contract, they help in movement. Okay, they help in movement. The muscles can be classified into voluntary muscle and involuntary muscle. Voluntary muscles are the ones which you can move when you think. Okay, so if you want to move, you can contract that muscle. Okay, so that is called as voluntary muscle. Example, all the movements which are attached to all the muscles which are attached to the bones, they are voluntary muscles. Okay, the involuntary muscles. Okay, the involuntary muscles, they are not under our control. That is, we cannot control the contraction of these muscles. Example, the muscles which are present inside our intestines. You know, our intestines is a tube-like structure, okay, and is made up of many muscles, okay, and these muscles are not under our control. Okay, the other muscle is the cardiac muscle, the heart. The heart is also made up of muscle, okay, and you cannot control the beating of the heart. Okay, so these are the two different types of muscles: voluntary, which is under our control, and involuntary and not under our control. The other classification is based on the looks, how it looks under the microscope. So it is divided into striated. Striated means lines, you can see lines, okay, and smooth, where there is no lines. Okay, so striated muscles and smooth muscle. The striated muscle is again divided into skeletal and cardiac muscle. Okay, so now we will be saying the three muscles: the skeletal muscle. These are the muscles which are attached to the bones. They are striated and voluntary. Striated means they have got lines, and they are voluntary. That is, we can control the movements of the skeletal muscle. The cardiac muscle, it is also striated, but it is involuntary. Okay, so it cannot be controlled under and by our conscious. We cannot control the beating of our heart. The smooth muscle, it is non-striated. There are no lines and involuntary. Okay, so these are the three different types of muscles. Now let's see each one of them. The skeletal muscles, the muscle cells, it's made up of muscle cells. They are long or tubular. Okay, I will show you the picture. So this is how it looks. They are long and tubular. They have multiple nuclei. Okay, they have many nuclei. You can see here there are a large number of nucleus. Okay, so there are large number of nucleus. Okay, the nuclei are flat and located on the periphery of the cell. So here you can see the nucleus is located in the periphery. Periphery means near the end. Okay, the nuclei is located near the end. Okay, the skeletal muscle is striated. Okay, so that is, it has got a line pattern, that is light and dark bands. So here you can see there are faint straights. Okay, so straight lines, right? So it looks like there are some small lines over it. So these are called as striations. So this is a striated muscle. Okay, and it is voluntary control. Now, sometimes we may give you a picture of this and then ask you identify what muscle tissue is this. Okay, so you need to look into the features. So you can see the striations and the nucleus. The nucleus is flat and in the periphery. Okay, it's in the flat and in the periphery, and striations is present. So this is a skeletal muscle. All right. So this is the skeletal muscle. The next one is the cardiac muscle. The cardiac muscle, They are not as long as skeletal muscle cells. Okay, they are also tubular but not so long. They are often branched. They are often branched. The nuclei is in the center. Okay, the nuclei is center. It is also striated, and there are specific structures located in the cardiac muscles called intercalated discs. Now we will see the picture. So here you can see, so these are tubular structures, and here you can see they are branched. Okay, so they are branched, whereas skeletal muscle was not this much branched. There were not so many branches. There are striations. You can see the striations, line structures. Okay, so they are striated. The nucleus is in the center. Okay, you can see the nucleus. It is present in the center, and you can see some small purple lines. Okay, and these purple lines, these are called as intercalated discs. Okay, so once again, the cardiac muscle, they are striated. The nucleus is in the center. They are branched, and there are intercalated discs. Okay, so 4 points for the identification of cardiac muscle. The last one is a smooth muscle. The smooth muscle is named because there are no lines and they are spindle shaped. I'll show you what is the spindle shape. It looks like this. This is called as a spindle. Okay, so there are no lines. Okay, and they are spindle shaped. They have a single centrally located nucleus, and there are no visible striations. Okay, you can see the nucleus which is present in the center, and there are no striations. Okay, so this is a smooth muscle. So skeletal muscle, striations, and the nucleus is in the periphery. Okay, the nucleus is in the periphery. Whereas cardiac muscle, striations, nucleus in the center, intercalated discs. Okay, intercalated discs. Okay, the smooth muscle, it is spindle shaped. Okay, the nucleus is in the center. All right. So these are the histological features of the skeletal, cardiac, and the smooth muscle. Any doubts until now? Okay.
So the
Now
smooth muscle, the
yes,
smooth muscle don't have any striations.
yes, smooth muscle does not have any striations. There are no lines.
Okay, thank
Okay, if you
you.
look under the microscope, they cannot see any lines in there. Okay.
Okay,
All
doctor.
right. Now coming to the next one. So this is an X-ray. Okay, and this is taken from a person. Okay, say a 24-year-old male. Okay, he is a baseball bowler. Okay, do you find any problem here? Is it normal or abnormal X-ray?
Abnormal.
Abnormal.
Why, why,
Abnormal.
why it is abnormal?
The bone is dislocated somehow.
Which bone?
Uh,
The collarbone.
This is not the
A
collarbone.
joint.
What is the bone which is
the
present in
arm.
the
Arm.
arm? Which bone is present in the arm? It was discussed in yesterday's session.
Humerus.
Very good. Humerus. The humerus is dislocated. This is the scapula. This is the clavicle. Okay, this is the humerus. Okay, so you can see that this is dislocation. The dislocation takes place in which joint? Which joint is this X-ray? The shoulder joint. Okay, so we will be seeing about the joints. A joint is nothing but where two or more bones come together. Okay, so where two or more bones they come together. The joints can be classified into three types: fibrous joint, cartilaginous joint, and synovial joint. Okay, so joints can be divided into three types: fibrous, cartilaginous, and synovial. Now we will see each one of these joints in detail with examples. Okay. Fibrous joint. The fibrous joint, it is named, as the name indicates, it is linked by the fibrous material. Okay, it is linked by fibrous material. So there are fibers which unites this joints. Okay, and since these fibrous materials are strong, there will not be any movement between the bones. Or in short, these are also called as immovable joint. Okay, immovable joint. They cannot be moved. Example, okay, sutures, sutural joint. Okay, so this is a joint. Suture is the name of a joint. Now, where is this joint located? Suture joint between the cranial bones. Okay, between the cranial bones. You know, this is frontal bone, parietal bone, temporal, occipital. So between these two bones, you can see some small corrugated structure. So this structure which unites these two bones is the sutural joint. Okay, so this is called a suture or sutural joint. Okay, and this is a type of fibrous joint. So suture is a type of fiber joint which is found in the skull. Okay, your questions can come like the muscle which is, sorry, the joints between the bone present in the skull belongs to which type of joint? Okay, so you should be able to, there will be many choices. Okay, and you need to look for the suture one. The next type of fibrous joint is gomphosis. Gomphosis. Now, where is this joint located? Okay, it is located inside the mandible. Okay, you know that mandible, the lower jaw, okay, is the lower jaw, and in the lower jaw there are teeth. The teeth is present inside the lower jaw. Now, what is the thing which unites the teeth and the mandible? Here you can see there are some small yellow colored structures which unites, sorry, white colored structures which unites the teeth to the mandible. Okay, these are called as periodontal ligament. Okay, periodontal ligament. Okay, and this joint, this joint, that is the periodontal ligament and the connective tissues which unite, which keeps the teeth in the mandible, is called as gomphosis. Gomphosis. Okay, so gomphosis is also a type of fibrous joint, and where it is found in the lower jaw, the mandible, and it unites the teeth, okay, with the mandible by means of periodontal ligament. The next one is between the two bones. Okay, so here you can see tibia and fibula. Tibia and fibula are located where? Any idea? They are
In our
located.
leg.
Yes, very good. They are located in our leg. Okay, so tibia and fibula. Now, these two bones are attached together by means of a membrane which is called as interosseous membrane. Okay, the interosseous membrane. Okay, inter means between, osseous means bone, membrane. Okay, so the interosseous membrane unites the two bones. Okay, so this is also another type of fibrous joint. Okay, so the fibrous joint, example sutures, which is found in the skull bones, gomphosis, which contains the periodontal ligament and unites the teeth with the mandible. The next one is the interosseous ligament, which unites tibia and fibula. All right, so these are examples of fibrous joint. The next, any doubts in this one in fibrous joint? Okay, the next one, the cartilaginous joint. The cartilaginous joint, it's mainly formed by cartilage. As the name indicates, it is made by cartilage. Okay, fibrocartilage. It's made by fibrocartilage. They act like a shock absorber. Okay, like a shock absorber. You know the cars, right? So the cars, when they go up and down, like now on a bumpy road, so there are shock absorbers which cushion it. So similarly in our body, so there are certain cartilaginous joints which act like a shock absorber. Okay, they are not, they are immovable. Okay, most of them are immovable, and sometimes they are slightly movable. Okay, slightly movable. Example, epiphysis and costal cartilage. Epiphysis and costal cartilage. Now, where is this epiphysis located? Epiphysis is located near the end of the long bones. Okay, near the end of the long bones, this is the location of epiphysis. Epiphysis is the place where the bone grows. Okay, so that's the place where the bone grows. You know, the child is of small height, but as the child grows, the bone also grows. So which part of the bone grows? The epiphysis. The epiphysis is the part which grows. The next one is the costal cartilage. Okay, costal cartilage. Costal cartilage, you know, this is the sternum and these are the ribs. The ribs are not attached directly to the sternum. There is a small part of cartilage which is attached to the sternum. Okay, costal cartilage. Okay, so what is the slightly movement? How come it helps in slightly movement? For example, when we are taking deep breath, when we take a deep breath, what happens? Our thoracic cage will expand. Our thorax expands. Okay, so the ribs moves a little bit. Okay, so this costal cartilages will help in this movement. Very slight movement. Okay, very slight movement. The next example of cartilaginous joint is intervertebral disc. Okay, that is between the vertebra. Okay, between the vertebra, this is intervertebral discs. Okay, so this is another example. This type of joints, they are called as symphysis joint. Okay, symphysis joint. For example, when we jump or fall from a height, okay, so what happens? The body will, the weight will, the force will be transmitted from our legs to the vertebra. So this cartilaginous joints, the fibrocartilaginous joint, they help in cushioning. They act like a shock absorber. Okay, they act like a shock absorber. And also it helps in bending. Okay, so when we bend forwards, when we bend backwards, okay, when we bend on sideways, the intervertebral disc act like a shock absorber, okay, thereby helping in slight movement, very slight movement. The next one is symphysis joint. Okay, symphysis pubis. Okay, symphysis pubis. You know, this is a hip bone. This is another hip bone. The two hip bones are joined on the anterior side by a joint, and this is called as symphysis pubis. This is also another type of fibrocartilaginous joint or cartilaginous joint. Both are same. You can say it as fibrocartilaginous or cartilaginous joint. Okay, so this is a fibrocartilaginous joint. So the three examples of fibrocartilaginous joint: epiphysis, which is present near the end of the bones; costal cartilage, which is present near the end of the ribs and is getting attached to the sternum; the intervertebral discs, which is found between the vertebrae. Okay, it is found between the vertebrae and act like a shock absorber; and the symphysis pubis, which is present between the hip bones. Okay, between the hip bones. So during the delivery of the baby, okay, from the mother, this symphysis pubis will relax. Okay, and thereby the baby will be passing through the pelvis. So normally it is not movable, but during the delivery of the baby, okay, so it will be relaxed a bit so that the baby can pass through the symphysis, through the pelvis. Okay, so that the pelvis, they will be relaxed. Okay, so during the delivery of the baby. So these are the cartilaginous joint. The next, any doubts in this cartilaginous joint?
Yes.
Yes, tell me.
What happens when we apply CPR to the cartilage's joints?
Your voice is breaking. Can you please repeat your question? What happens?
What happens to the cartilage's joints when we apply CPR?
Yes, good question. When we apply CPR, sometimes usually when there is a slight pressure, they will not break. Okay, example in children, like if they do CPR, there will not be any breakage. Okay, there will not be any fracture. But in a very old person, okay, that is a very good question. Okay, so in an old person, if you do CPR, sometimes there could be a fracture. Okay, because why in child there is no fracture? Because most of the places there is cartilage. The ribs, they are formed from cartilage. Okay, and when you do CPR, there might not be any fracture. Okay, whereas in an adult, in say in an 80 or 90-year-old man, you are doing a CPR. Okay, so in that person, the cartilage, the costal cartilage will be weak. Mostly it will be replaced by a bone, and when you do a CPR, there is more likelihood of fracture. Okay, any other doubts?
Okay.
All right, thank you. Now next one is the last one, the synovial joint. The synovial joint. The synovial joint, it has got many specific features. Okay, I'll discuss this one by one. Okay, so these joints are completely movable joints. They are freely movable joints, synovial joints. Okay, we have seen immovable joint, which is fibrous joint, slightly movable, which is cartilaginous joint, and freely movable is the synovial joint. Now, when they are freely movable, the joint has to have certain modifications. So there are certain modifications in the synovial joint. We will be able to see the articular cartilage, capsule, synovial membrane, synovial fluid. Okay, so these structures are found in the synovial joint. Now, where they are located? So here you can see this is a synovial joint. The two bones are coming in contact with one another. Okay, now here if you see, this is a bone and this is another bone. But the place where the two bones meet, the bones are not coming in direct contact. There is something white colored structure which covers the end of this bone. And what is the name of this white colored structure? Articular cartilage. Okay, just like a rubber. Okay, you know, in an engine. Okay, so if there are two metal parts, if they come in direct contact, there will be friction. So in order to prevent friction, so there is a white colored structure which protects these bones. This is called as articular cartilage. Articular cartilage. Now there is also a space. Okay, there is a space between the two bones, and this space is filled with synovial fluid. Okay, it is filled with synovial fluid. Just like you add oil to the engine. Okay, why do we add oil to the engine? To prevent friction, because the motor pump, okay, goes on up and down. Okay, so when the motor pump, okay, goes up and down, there will be friction. In order to avoid friction, we add oil, right? So similarly, in our joints, naturally there are fluid, okay, which is called as synovial fluid. The space is filled by synovial fluid. Now, where does this synovial fluid come from? Okay, so there is synovial fluid, but where does it come from? It comes from the lining of the joint cavity. Okay, the green colored structure. You can see the green colored structure, the lining of the joint cavity, and this green colored structure, it's called as synovial membrane. Okay, the synovial membrane. So the synovial membrane will secrete the fluid, synovial fluid. Okay, so that when we move the hand or the shoulders, okay, or the knee joint or hip joint, there are no sounds. Okay, so this movement is smooth. Okay, so the movement is smooth. Now there are many tiny structures as we have seen. There is articular cartilage, fluid, synovial membrane. Now this fluid should not escape outside whenever we bend, okay, or whenever we run fast. Okay, so this fluid should not escape outside. So what is there? There is a structure which prevents the or which strengthens the two parts of the bones from outside. Okay, and this is called as fibrous capsule. Okay, and this is called as fibrous capsule. Okay, the fibrous capsule will be the fibrous capsule will be attaching the two ends of the bones. Okay, they will be attaching two ends of the bones. So we have seen articular cartilage, the capsule which strengthens the joint, the synovial membrane, and the synovial fluid. Okay, so these are the structures which you need to know in this diagram. Okay, the articular cartilage, the synovial membrane, the synovial cavity, which is filled with synovial fluid, and lastly the capsule. Okay, the fibrous capsule. Okay, now there are other structures. Apart from this, there are other structures which are called as bursa, menisci, and ligaments. Okay, bursa, menisci, and ligaments. Now, where are these located? A bursa in this diagram, you need not note all the things which is present in this picture, but note the location of the bursa. Okay, it is located between the two bones. Okay, it is just like a fat pocket. Okay, a pocket of fat which is lined by a membrane. Okay, and they are present outside the joint cavity. Okay, they are present outside the joint cavity. So this is the bursa. Okay, so certain places bursa is located. Okay, so bursa, menisci. This is the knee joint. So inside the knee joint, you can see meniscus. Okay, you can see the meniscus. Okay, so these are some of the modifications of the synovial joint. Any doubts until now? Do you have any doubts?
Yes, doctor, the menisci only exists in the knee or what?
Yes, the menisci will be present only in the knee joint. It is present only in the knee joint. Okay,
Okay.
so synovial joint has got articular cartilage, synovial cavity filled with fluid, and synovial membrane and fibrous capsule. Okay, and outside the joint, there could be certain structures called as bursa or menisci. Okay, or menisci. Now, the synovial joints can be classified into so many types. Okay, they can be classified into ball and socket, hinge, gliding, pivot, condyloid, and saddle joints. Okay, just like you have seen examples like sutural joint. What is the example? Okay, the cartilaginous joint. What are the examples? Gomphosis. What is the example? Okay, so you need to know what is this joint, okay, and what are the examples. Okay, so here you can see ball and socket joint. Okay, in ball and socket joint, One part of the bone is ball shaped and the other part is like a cup shape. Okay, so that the ball fits into the cup. Okay, so this is called as ball and socket joint. Okay, example, shoulder joint and hip joint. Okay, so here you can see the shoulder joint. Okay, the humerus is looking like a ball, and the scapula part, this is looking like a cup. Okay, so this is an example of ball and socket joint. Example, shoulder joint and hip joint. Okay, so in your exams we will be asking you which one of the following is an example of ball and socket joint, or the other way could be the shoulder joint is an example of, okay, ball and socket or hinge joint, or like that. Okay, it can come either way. The hinge joint. The hinge joint, you know the door, right? Like a hinge on a door. What happens when you open the door? Okay, the door can be opened only on one side. Okay, you can either push or pull. Okay, only one side it opens. It doesn't open on the other side. Now, what are the things which what are the examples for this hinge joint? Okay, example is elbow joint. Okay, so here this is the elbow joint. This is the lower end of humerus, and this is the ulna bone. Okay, ulna bone of the forearm. Okay, so elbow joint, knee joint, ankle joint, and interphalangeal joint. Inter means between, phalangeal means fingers, that is between the fingers. When we grab something, when we hold a pen. Okay, so these joints are like hinge joint. That is, you can extend the elbow joint. Okay, but beyond a certain point, you cannot bend it. Whereas the shoulder joint, you can rotate into 360 degrees. You can rotate into 360 degrees. But the shoulder joint, sorry, the elbow joint, you are unable to rotate 360 degrees. Only 90 degrees you will be able, sorry, 180 degrees you will be able to do it. Beyond that, you cannot extend the elbow joint. The same with the knee, ankle, and interphalangeal joint. Okay, so these are examples of hinge joint. Okay, the next one is gliding joint. Gliding joint. So here the bones are flat, okay, which helps in the movement. Example between carpal and tarsal bones. Where are tarsal bones located? Tarsal bones are located in
Foot.
ankle joint. Okay, the tarsal bones are located. This is from yesterday's topic. Yesterday we have seen, right, tarsal bones. Okay, the tarsal bones, they are located in the ankle joint. And any idea like how many tarsal bones are present in our body?
14.
Very good. How many tarsal bones are present in each lower limb, each ankle? In each ankle, how many tarsal bones are located?
7.
Yes. Okay. So read the
7
questions
in
before
each.
you answer the questions. Yes, good. Okay. Similarly, carpal is for the wrist. Okay. So between the carpal bones also the gliding joints are present. The next joint is the pivot joint. Pivot joint. Okay. So what happens here? There is one projection. Okay. And the above bone rotates on this projection. Okay. The bone. For example, this is a C1 bone. C1 means cervical vertebra number 1. You know how many cervical vertebrae are there? There are 7 cervical vertebrae. The first cervical vertebra and the second cervical vertebra. Okay, so beyond the first cervical vertebra is the skull. Okay, the skull is present above it. Okay, the C1, that is cervical vertebra number 1. Okay, and this cervical vertebra number 2. Okay, now in C2, you can see there is a projection. This projection is called dens. Okay, and this dens is attached to the atlas. Okay, it is attached. There is a joint between the dens and the atlas. And what happens when we turn our head, when we say no or turn our head from side to side? The skull also moves. So how come it moves? It moves in this joint between C1 and C2. It moves. Okay, the C1 cervical vertebra is also called as atlas. Why it is called atlas? You know the Greek god, right? The Atlas. Okay, so he will be holding the globe, the earth in his hand. Okay, so similarly, the atlas bone, it holds the skull, the entire skull. Okay, so that's why the C1 cervical vertebra is also called as atlas, and C2, because the C1 rotates on it, it is also called as axis. Okay, the cervical vertebra 2 is also called as axis. So this is an example of pivot joint. Okay, pivot joint. Okay, which takes place in the dens between axis and atlas, that is C1 and C2. So we have seen four joints now: ball and socket, hinge joint, gliding joint, pivot joint. Okay, now the next joint is condyloid joint. Okay, condyloid joint. Okay, so this joint, here also you can see there is rounded structure, but it is not in the shape of a ball or a round, a full globe. Okay, it is just like a small portion, like a small portion of the sphere. Okay, so this is present between the temporomandibular joint. Okay, temporomandibular joint. So what is this? Where is this present? Temporomandibular. Mandibular, you already know, mandible. Mandible is the lower jaw. Okay, and temporal bone. So between the temporal bone, that is in front of the ear, okay, so there is temporomandibular joint. Okay, so whenever you open and close the mouth, okay, you can feel it on your side in front of your ears. If you keep your hand and open and close your mouth, you can feel the temporomandibular joint. Okay, the temporomandibular joint. The next joint is metacarpophalangeal joint. Okay, as the name indicates, metacarpal. Where are the metacarpals? These are the metacarpals. These are carpals. These are metacarpals. Okay, metacarpophalangeal. Okay, that is between the metacarpal and the phalangeal joint. So this is a condyloid joint. Okay, so the condyloid joint is found in the temporomandibular joint and metacarpophalangeal joint. The next one is saddle joint. Saddle joint. The saddle joint is just like a horse. Okay, so on the back of the horse, a person sits, uses a saddle to sit, right? So here also it looks like a saddle, and on the top of it, there will be a bone. Example between trapezium and the first metacarpal. Okay, the trapezium is nothing but a part of a carpal bone. Okay, it's a part of a carpal bone and the first metacarpal. Okay, so this is the first metacarpal, second, third, fourth, and fifth. So between the first metacarpal and the trapezium, okay, so there is the saddle type of joint. Okay, so once again, let's see what are the different types of joint. Ball and socket joint, example shoulder and hip, hinge joint, elbow, ankle, knee, and interphalangeal joints, the gliding joint between the carpals and tarsal bones, the pivot joint between C1 and C2, the condyloid joint present in the temporomandibular and metacarpophalangeal joint, and lastly the saddle joint between the trapezium and the first metacarpal. All right. So this is the end of the session. Do you have any doubts?